Sweet.
All right, Gabe. Yeah, Thursday's always when we bring in folks in the medical community. So today we're going to talk with Dr. Karen Frew. We're going to run through all your qualifications. MD, PhD. She's with New Hanover Regional Medical Center's Physicians Group, the Coastal Reproductive Endocrinology and Infertility. It's a lot to say, but it's important work, and it's a sensitive subject when we talk about infertility. And one of the things I wanted to say to you was, I think unfairly, when we think infertility, we think women, and it's not just a one-sided thing.
No, it is not just a woman-only problem. So what I like to tell my patients is a good 10% of the population is affected.
Okay.
That's 10% of all women ages 15 to 44, and 9% or so of all men ages 15 to 44 as well. And when they come in, a third of the time I find a problem with the woman alone out of the couple, and a third of the time a problem with the man alone out of the couple, and there's another magical third where there's something going on with the guy and there's something going on with the women.
And you say magical, you know, it's not like all of a sudden you develop a spot and you realize, hey, I might have an infertility problem.
Well, it's magical to the patients because it's the first time they're hearing it.
And again, it's not something until you start deciding that you want to perhaps think about a family that all of a sudden this can really change your life.
Oh, absolutely. So we typically have people referred to an infertility specialist if they've been trying for a year and are unsuccessful. But for women over age 35, they're referred after 6 months of trying. So I think as long as we raise awareness on that topic, we might get to patients a little sooner, so they have to struggle with the whole thing shorter.
And I was going to say, age can really be something that you're fighting. You're really fighting time at some points.
It's a non-modifiable risk factor. I can fix almost anything else. So if the guy has low to no sperm, we could there are things we can do like IVF to address that. If the woman does not release an egg, we can give her medicines to address that. If her tubes are blocked, we can go bypass it with IVF. There are other things we can do, but age is a non-modifiable risk factor.
Yeah, when you talk about IVF and in vitro fertilization, we're talking about, you know, we have twins, and a lot of people are asking us if ours are natural. You know, and I mentioned right away that this is a sensitive subject. I will tell you one thing. You are such a kind soul to talk to that I can see where this is something that is just right in your wheelhouse to just lend comfort to people. And you had said that your last visit, 50 births.
Over 50 births in the Wilmington area, and 160 pregnancies.
That's awesome.
So.
You're doing great work. I appreciate the time.
Thank you so much.
Thank you very much. We're coming back after this.